Yeah, I know, well. Alright, so I'll just start off real briefly. The budget that you have in front of you is our best effort. There is a lot in here that has to do with the reorganization. Since the time I've been here, we've noticed a few things. We'd like to address it in the budget. I know last night we talked about one of the positions. There's a couple others that are in here as well. Really the goal, just so you know, our casework is still increasing. We're seeing about an average of about 108 cases a month coming through. Our eligibility caseload is as equally as busy. We're averaging another 100 and some with eligibility. So it's not like work has lessened at all with VSS, it's actually increasing. It's statewide, it's not anything specific to Montgomery County, these are the trends that are occurring throughout the state. So it's not something that Montgomery County we're doing either right or wrong, or people are doing right or wrong, this is just the trends that we're seeing throughout New York State. So the budget really does represent some changes in the organization. It does eliminate some of what I would consider the deputy commissioners and commissioners positions. It does create, I think, a better pattern for promotional opportunities within DSS that will be civil service based and test based. I think that there needs to be some consistency within the Department of Social Services when it comes to staffing, that when there's been changes in administration, we've had 3 changes in administration in 3 years, approximately. In there, it creates a lot of stress for staff. There needs to be a consistent basis on this and really try to eliminate some of the positions that were appointed or at the leisure of commissioners. It doesn't really help with the sustainability in the flow of an organization that desperately needs it. These are kids and families whose lives are basically in our hands at times. So, I think it's very important that we really try to build a structure that represents the importance of the work that is being done in DSS. I know that these positions were created in the past, there may be questions that come out, why was it eliminated, we're coming back, 4 or 5 years later, and we're revisiting this. I'll be happy to explain those situations, just based on, years of experience that I'm bringing to, to help us here in Montgomery County. Again, the county executive's mission is to create a Health and Human Services organization. I'm a firm believer in that mission. We're taking small steps right now. There's a lot of cleaning up that really needs to be done, this reorganization. It's not even really cleaning up, it's really more of a reorg on DSS, and we can really start to, dive into where the intersections are with public health and mental health, and really begin to create a newer structure. That's why you'll see we didn't do one, we kept budgets separate. We did create a new position for Health and Human Services. It's not a new one. It's actually, we built this in already earlier this year. So, we're making our steps, and this is gonna be our goal for next year, is to really have a firmer idea of where we wanna be with Health and Human Services. We're still a little ways away from being all in the same building, so the timing works perfect for us to focus on DSS right now and get it ready for when we're all in the same building. So I'm gonna open it up for questions. I would just share with you that Jess Bates is here with us. Jess will handle a lot of the particulars about revenues and some of the expenditures, and then any of the personnel issues, I'll make sure I can try to address for you.
Do you have the budget frame?
I do.
On page 30,
Yep.
all the positions, if you go down, there's Director of Social Services, Director of Eligibility.
Yep.
Are all these new positions, or are they replacing positions?
So what we do have is we are eliminating approximately 11 positions. And I can get this all to you, all of you at some point. We're eliminating 11 positions, and there's a creation of 8 new positions.
What's the net effect?
The net effect is a little difficult to figure out, to be quite honest with you, just because what it does is bring into longevity. It brings in other factors, on those positions that it wasn't a part of the budget that Jess and I prepared, that, like, again, last night, you know, the county executive and the treasurer and the HR really worked behind the scenes on the salary adjustments piece.
Okay, you're done, I can leave this stuff on your feet.
No, go ahead.
So, give us a ballpark, is it a plus, is it a minus?
You know, my estimate to you would be that there's no, so with the salary survey and longevity, there's really not much gain or difference with the elimination and creation of the
So it
position.
should be neutral?
It should be neutral. That was our goal.
So are people just being shifted, or are people actually losing jobs?
Well, there has been some loss of job already, when we had some personnel discussions with people who may have been impacted by this budget, by the proposed budget. So that was last night's resolution, was one of those instances, where someone left knowing that this was proposed in the budget, and we were able to try to put this new organization in place. There will be others. We are gonna try to use the current staff that we have, if they're eligible, and if they are qualified to be in the positions, they will be welcome to actually apply for the director's positions. So one of them is the, director of eligibility. What we will be doing is we will be eliminating a head social worker welfare examiner. So we have two now. When we go to the new building, we'll have a director, and then we'll eliminate one of those titles.
Are there any other questions?
I do. So, your adopted budget in 2023 was $30 million. Your request was 33 million and a half. The executive budget is about $600,000 more than that. Can you give some synopsis or some major financial points that affected that?
I'll give you the 30,000-foot view, and then if Jess wants to fill in with some of the further details, she can as well. So when we met with the county executive and the treasurer, they asked us to come up with some additional revenues to help support. The way our funding works is, as you all are well aware, we work based on federal fiscal years in some of our funding. We work on state fiscal year on some of our funding, and we work on calendar year on some of our funding. So our allocations, revenues, any sorts of money that are coming, we could be getting new announcements. We were getting them today. So once we had the meeting with the county exec and we had the meeting with the treasurer, Jess actually went back, we did another analysis of what we had. We saw that we had additional revenues that were already came out from the time we had met with the county exec to when he asked us to make some additional changes.
Are those the child care line that's up,
Childcare is definitely one of them.
and then the social services?
Was it the admin, the other one?
Yes, that is correct.
Those are the two big ones. But your
And-
appropriation, I'm sorry.
What was your, well, you can have it.
So, but your appropriations went from 30 million to 33.5, 34.1. That's a pretty good size. It's a sizable increase in appropriations. Is there any highlights in there without going through and, paring it down?
Medicaid expenses up.
Absolutely. If you want, I can answer that. Our largest increases begin with daycare, and that actually attributes for 56% of the increase for this year for appropriations. We received additional allocations, so that is reimbursable, but that is $2.3 million. So there was a massive expansion of the program within the last year, and they continue to expand the program for us. Not only within eligibility, but in helping us to fund that as well.
And when you say it's reimbursable, is it 100% or is it a different percentage?
It is almost 100% reimbursable. There is one small portion, it's about, between $11,000 and $12,000, which is called our maintenance of effort, that is the portion that is not reimbursable. And is what we are required based on 1994 levels to pay out of local funds. The
So
second.
that leaves about 1.2 million.
Yep, the second largest increase that we had was in 6,100 for Medicaid. And that is the Medicaid weekly shares that we pay for that program. And that was 1,213,000. And that was something that yep, that was an increase of 1,213,000 and some change. And that was in 6,100 Medicaid line. That is the weekly shares that we pay to the state for the Medicaid program. And that is not something that we have any control over. It is set by Department of Health, and they set the rate that we are supposed to pay to them. The last set of guidance that came out was the elimination of both the COVID reduction that we've been benefiting from for the last several years since 2020, as well as the FMAP reduction in shares that we've also been benefiting from for quite some time.
What's that?
It's a portion, like a percentage that they assign, saying that they will reduce our shares for this year by this percent. Unfortunately, that calculation is not available to local districts to understand the computation.
The FMAP is a really big bone of contention right now because it involves federal dollars that go to the state that should come to us. The state is claiming they've reached the max and they're holding more of it. It's been something we've been following closely, and information is just, it's as it happens, it's a fluid situation, I guess.
Thank you. You have any open positions?
Yes, we have a lot of vacancies.
How many? Would you, rather than answer that, will you get us a list of
Sure.
open positions and the financial
Yep.
implications and the same? Thank you.
And just, speaking of that, I just wanna say that I really appreciated what the county executive and Nicole and Sean did in regards to the salary surveys. I know that this was a lot of work for them. We are desperately needing to adjust some of these salaries. Retention recruitment continues to be an issue for us. I really appreciated the county exec and the treasurer, valuing the opinion of not doing it for certain groups and really trying to tackle this all at once. I think it's really the approach as we move forward, in my humble opinion, that we need to do, because this offshooting and, doing it for one group and not the other really puts us in this situation year after year where we're fighting, for each other against departments, to get recruitment and retention, and we're fighting for the same employees. And the difference of $6,000 or $7,000 makes a lot to a potential employee. So they're choosing to go where the money is as opposed to where maybe their passion and desire to work is, which, for all of us at the county is something we should be concerned about. We'd rather put people who actually care in these positions and can do the jobs than just having people chase that money.
Now, didn't we already do a bunch of different ones in the social services department to begin with?
We did caseworkers, and even after doing that, the data on the peer market is that they were still underfunded because other counties are doing the same things. That, I believe, was the big one. I don't believe there was many other changes in there. That was in that first round when we did MEO1s and caseworkers. One of the ones that was on the brink of being brought to you and ultimately wasn't was the social welfare examiners, which is a big one for the department. And the way it was done with both CSEA and non-bargaining at all at once, and this time, now you're not dealing with crunching issues, and that's what we were dealing with before, is trying to pick your spots where you could have an impact where there's a crisis, and this sort of levels the field countywide by doing, so it's technically, all at once because you got CSEA and non-bargaining, but I would refer to the initial pass out from Nicole, which shows a lot of the work that's been done with all the other bargaining units as well.
move from Amsterdam to Amsterdam, and from Fonda to Amsterdam, are we going to have double coverage? Are we going to, is there a plan that what happens to some of these people that, I mean, because we have vacancies now, and if we fill some of these vacancies, then these people don't have places to move, what's the plan?
That's where you saw the reorg, and I think that's what you
Yeah.
were getting into. The whole, all that reorg that he's discussing has been singularly focused on the existence at Better Road, and I bet can talk
Well,
about that.
I'm talking about if you have a receptionist down
Sure.
there and a receptionist up here, now you've got two receptionists, but if we've already have all the other positions full, the person that's been a receptionist here for 15 years has been a good employee.
Yep.
We just,
So, I would just share, Nicole and I had several long conversations about the staffing. The receptionist was actually one of the areas, I'm glad you brought that up, that there's 3 of them. And we talked about when we get to one physical location, what does this look like? So we know for at least the first year that we are all together at Venner, we're way behind on scanning. We're way behind on a lot of other important documents that we can alleviate space. Some of the concerns that we have here at the county is we're running out of space. Well, some of the space that we're occupying is a lot of paper and files and paper files. We can reassign some of those receptionists for that year in order to do some of the things that we haven't been able to do in the past. And next year is really gonna be our baseline of determining how many of these positions we absolutely need to do the work that we need to do. So this is part of the goal for next year, is what we're calling that same building, is to have some of those crucial conversations about staffing levels. Some of them are not easy, you're right, 15 years a person could be working, great employee, but we also are stewards of the financial aspects of this county, and we've gotta put together our best effort too when we do our
but I
budget,
hate,
so.
but I hate personally, I hate to see people being brought in, brand
Yep.
new, to fill a spot where someone that's already here working could be retrained or could be doing something for that position.
So that's what we're gonna look at. So I just wanted you to hear that loud and clear. We're gonna look at those good candidates that we have. We're gonna see where else they can fit within the organization before we would actually try to move someone or do anything that we could. Again, some of the civil service we're gonna have to work with and make sure that we're not, doing anything against the civil service part of this. But yes, that is our goal, would be to keep our good workers and put them into different positions.
So really the goal also would be not to be too crazy filling positions, just to fill positions, not
Yeah.
knowing that you're going to have to eliminate positions.
So I'm, part of my background in government has always been to look at these consolidations and really to evaluate staffing. So I think it's one of the reasons the county exec, hired me. I think he has faith that we can do that as a department. So yeah, those are key conversations that we're gonna have to have. Cause I'm not here to build an empire. We're here to do what's right for the children and family we serve.
Would you have that list for us tomorrow afternoon?
Yeah, so you need the vacancies.
The vacant positions and the financial implications of them.
Perfect.
How are we doing hiring the new attorney line that we created?
It's been a little bit of a challenge. Again, I really appreciate you all helping and understanding the need for the position and the salary that it's at. Again, there's some things that are done in the budget that I talked about earlier that do have impacts, right? There's other attorney positions within the county who are now going to be making more money than what we just adjusted as DSS, potentially could be. Making more money than what we just adjusted DSS to, right? So it's a little bit of a barrier. We have a good candidate now. I'm hoping to hear good news on Friday.
Any other questions?
I have a question. Are your vacancies based on today's scenario of 2 locations or what will be?
So what we will give you is gonna be based on today's. So next year's, again, I just wanna really make sure that we're setting that baseline. What we're asking for in this year's budget is what we think we need. We will know more once we're all together, and then we can revisit. And if we don't think there's vacancies that we need to replace, we won't. If there is additional positions, or if they're better said, positions that we need to acquire in different units within DSS, then we will do that throughout the course of next year. But we will not do anything that will hopefully adjust that bottom line for positions and salaries. We're always gonna look to make sure it equalizes. Does that make sense?
Yes.
Okay, thanks.
Yeah, Matt, how you making out with caseworkers? It's always been an ongoing, well, at least more recently, you know, hard to get them, hard to keep them. Are we short of them right now?
Yes, so we're down about 5 caseworkers. It really does have an impact. I was just, we're on a corrective action plan with the state that occurred prior to me being here. Again, I'm not pleased, I don't mean that to be judgment on anyone else who was in these positions prior. This is the nature of the work, it has nothing to do with the people. But being down 5 caseworkers, we're about 63% behind on our caseload. We're having mandatory overtime right now. So again, remember that outcome is the kid and the family who are in serious conditions, possible neglect, possible abuse, that, we're behind on caseload. So, we're at mandatory overtime right now for our caseworkers. We're instituting a bunch of things to try to address that so that we can ensure the safety and well-being of the kids that we're here to serve.
Are you getting bites for those?
We are getting bites, but, one of the issues that continuously happens is that it's a long requirement for training.
Mhm.
So the state requires us to go through a series of trainings before a caseworker can go out on their own. So right now, we have 2 caseworkers who have been there. One's been there probably 3 months, the other one's been there 6 months, and they can't go in the field on their own yet. So even when we hire new caseworkers, it still takes us a while to catch back up. So the dependency becomes more, our supervisors are carrying caseloads, our senior caseworkers.
Who accompanies them, a supervisor?
So a supervisor has to go, they can do secondary reviews is what we call them, or they can do notes, they can help us in other ways, but they physically can't go and do site visits on their own.
So that's gotta affect the workload too, because if they're accompanying a rookie,
Yep.
they can't be doing it on their own, which is making it fall behind even further.
Yeah, so, I will just say Lucille has been an incredible asset to us already. I will just share with you what we get for her, that position's salary has been tenfold. She's looking at creative ways that we can restaff, creative ways that we can do things to try to address some of those exact situations.
A lot of people in need out there.
There's a lot,
If we
there are
can't
108
address it, it's,
Yep.
that's a problem too.
Yeah, we're at,
With,
today, when we ran it, was 48, CPS, calls that we had already in October.
How many caseworkers do we have?
I can get you that, I don't wanna just
About.
rattle off, let me stick in my head, 1, 2, 3, 4.
Brad and I, we hear it back there.
You hear it rattle? Yeah. It's old. I'd say 10, that's including seniors.
And how much does a caseworker make?
it's on page 29, if you look at the top, you get a general, anywhere from mid-40s to, right?
Yep,
Right
we have a new
now,
one
it's like
starting,
mid-50s.
we have another new caseworker starting, in a month. So,
49, did you say, Mike?
It looks like, on
55.
average, 50, 45 to 55.
And how many hours a week does a caseworker work
we
without?
work 35 hours a week here.
Yes.
Yeah.
Does that change during the summer?
Most do.
Well, summers we do lose the extra,
Just summer hours, yeah.
30 hours?
Yeah.
30 hours?
I think so.
And how much overtime do you think you're spending?
So right now, we got mandatory 3 hours.
So
Other times, if you're on call,
A day or a
it's
week?
good, a week.
Okay.
We're trying to control the cost, and still serve
So
food.
what's the financial implications of 3 hours a week or 10?
I could run it for you and get it for you tomorrow.
But if we're at 35 and they're doing 3 hours extra, isn't that below, right?
Yes, and they're using comp time, am I getting that right?
So your salary for a caseworker is $45,703 as of 10/19,
And that's the base.
and that's the base.
Base.
45.9?
45,703.
A lot of them are slated to get increases, I see, right? A
So
lot
it
of-
ends up, I mean, obviously, you know what ends up happening with comp time is then you're on the books, so after a certain amount of time, these are the things I always have to look over my shoulder on.
You're just
a little bit
liquidating your
different.
future.
Yeah, and or you're getting to use time off. So if you're gaining it in comp time, you're taking it as time off, so we're losing those hours of work, one way or another.
That new person that you're bringing in, are they at rookie status and will have to start?
Yeah, so we're always, I mean, you know, it's gonna be very rare where we're not at a rookie status for a new caseworker. They've gotta go through a training institute at OCFS.
And how long is that training?
6 months.
It could be anywhere from 6 months to up to, 9 to 12 because of the timing. So they only do these institutes every so often.
So I just have one more question.
Sure.
So the starting salary is 45,703. What is the proposed change?
I don't have the CSE.
5258,
52, 58?
50,258.
And also just to keep in mind, one of the other challenges with the caseworkers is, one of the requirement is a 4-year degree, so what you get a lot of times are people fresh out of college that are looking to start their career. They come in, they get trained, they get a couple years of experience, and the ones who are good end up, moving to another way. It's a great way to get out of college and start a career, you show that you can handle responsibility. So we've been bit in the butt a number of times in that way, which is why we addressed the salaries, not only the salaries, but last time in CSEA, the increments that you get over the years, for you stay 1 year, you stay 5 years. That was adjusted as well to try to address that point.
Are we cross training?
Yes, so we have instituted, we're actually, there's 3 different units. So we have our adolescents, we have our foster care, we have CPS, we have adult protective.
And so if somebody is a caseworker in child protective, can they fill in for adult?
So that's what we're gonna start doing, Legislature. When I got here, we realized there was an attempt to try to do some mentoring in the past. Now what we're doing is we've had a new caseworker that started, we're putting them 3 months in each one of the units. So that way they're exposed to every unit, so that way when and if we have those situations, we will be able to deploy people a little differently.
And are there processes in place, did you ever hear this? Are there processes in place, for training so that we're maximizing our reimbursables and not ending up, down the road, bringing people in and, we found more money.
Yeah, so, what the county exec talked about, ours is a little bit different than the sheriff's department or some of the other departments. We're not having to, our time in training is the investment in it we're losing the resource of the staff, right? All of those trainings are free, they're provided by OCFS, so we're not incurring any costs that we could potentially get back or keep people for a year. I don't know if that's where you were headed.
Are we making sure as we're hiring new people that we're maximizing our reimbursables? So if there's new people in the financial department, are they being trained so that we're not missing money that's reimbursable to us?
Yes, so that comes back on a report, the hours of training per person for the quarter, and it actually allocates it out to each one of the programs, and the reimbursement is based on that.
I don't care about the training.
Okay.
Yeah, you're asking,
Are we making sure that we're
in
getting
our
every
accounting
nickel?
department,
Are we
yes.
making sure we're getting every nickel?
So the real attention since, I was officially appointed at the end of June has been on our services side because we had a corrective action plan that was in place. I haven't spent as much time yet with the financial side of this. I have faith that Jess and her team are doing those things. I also think that there needs to be a regular period of time that we're always reviewing and rechecking things.
When was the last time that we had Bonadio in here to review that?
It's been a couple of years, but I know that Matt has reached out to Bonadio as recently as the last month or so.
Okay.
So there's about $200,000 in one of our line items that I asked Jess to put in, that we could do a contract with them again to come in and look at the proposal that we have is to look at 3 specific areas, one of which is raise the age, which is very new to the state. It's very costly, They've done this in other counties. They see a potential of helping us to create and maximize there. And we're gonna look at 2 other areas that we know.
I think the last time 4E was in.
It was 4E, we've done great. From what I have heard, you know, everything that was put in place, we have followed and done. And, you know, one of the keys is when we talked about a deal, was really creating a process and a manual after they do something. So we have a living, breathing document that it's not just when the people that were here and went through it, they learn those best practices, but that we actually have something that afterwards can be passed on. So when we have these transitions in staffing, that moves on with, it stays in the position, and our positions don't become so dependent on people.
Yes.
So yes, that is absolutely what we're looking at.
Matt, tell us a little bit about this corrective action plan. What are the hot buttons it's touching? Is there a time limit on it? You know, when did it start? When do they wanna see your action plans implemented for their review to make sure, you know, I mean, can you just educate us on it a little?
Sure. So, you know, it occurred in 2022, I believe, was when we really came out. They came out and did some extensive auditing of our program areas. The report came out, got released around June. We had to do a
Of
correct.
this year?
It came out in May, and we had to do a report in June.
Okay.
Of how we were gonna address and deal with some of the issues. The majority of it is our overdue cases. So, you know, there's an extreme risk on the overdue cases that, you know, the safety and well-being of the children and families who are there, and we're trying to help and investigate what's going on, that something could be happening. So, you know, if we're overdue, time periods are lapsing, more potential risk is at stake, right? So the state comes down and they tell us, like, you really gotta pay attention to this. So, you know, the previous administration was very creative. They came up with a red folder that basically, you know, a high sensitive case would be put in a red folder, that would get immediate attention, right? So that way we were at least we were assessing safety as a major concern. What we did now is we also brought the state back in to do some coaching. The one thing that I will say is that OCFS is a very good partner. Even though they're our oversight agency, they're also here to help, which I think has been something that, you know, for years, it's been a delicate balance to have your oversight agency come in and be also helpful, right? I think some of my experience with OCFS and that I came from there is gonna help alleviate some of that tension and fear. So we've brought in coaching where actually, you know, we have a trainer who's going out in the field with our caseworkers and observing them and giving them concrete feedback now. So that takes away on how we don't have to send out a supervisor to do that. So we're accessing resources that are there to help us. So our corrective action plan was about 25 pages. I don't have a problem sharing that with you guys
I
as
just
well.
wanted to, I mean, if everybody else wants it, there'll be a consensus, but I just wanted to get, so you're talking about, you know, the example you just gave was more of a client, end user relationship basis. Were they looking at other things like operations and how we process things well or not well, or claims and things of this nature?
So OCFS is much more of we do get allocations from OCFS, but OCFS is much more of our services side. They're not as much as our financial side. OTDA is really where our financial guidance comes from. So they looked at it, from this one, it was much more from a services side, the end user.
Not
They were concerned
operations.
about,
Okay,
correct.
okay.
Not about the financial pieces, this is much more about the end users. You know, they took specific cases and looked at them through their
Got it.
entirety and said, hey, at these sections, maybe you should have tried this or tried that.
I see, okay. That's what, thank you.
Yeah.
Matt, on the governor's proposal to cut hundreds of millions, where does it fall into the budget?
So the FMAP, and that's what we're talking about, has been back and forth. I don't believe we've seen the cuts to those weekly shares, I believe they're called, right, Jess? That we expected initially. They keep saying they're gonna make us whole, but it remains a huge impact in this year's budget, but it's something we're keeping a close eye on. Emails are coming out weekly, monthly, just keeping us up to speed on that.
Because we're supposed to see a lot of it in 2024, right?
Potentially.
We should have seen it this year.
Yeah.
And Jess did a really good job on last year's budget of under projecting, like you guys had talked about last night's meeting. And really, it helped us not be in nearly as crucial of a situation in that one particular funding category.
Sometimes when these things happen, it's a little easier for the smaller counties to absorb than some of the bigger counties that just have gaping holes. But, so far right now, it's, at the last executives meeting, you know, it was talked about, we got an update, but it wasn't necessarily at a crisis level as it was the previous couple get-togethers.
You feel your revenue projections are, I mean, that's what's helping offset the appropriation increase. Do you think they're real? You know, about the 3.8 in revenue projections, change year over year versus the change in expenses of 4.2 or whatever it is.
So I've relied on the guidance of Jess, on the county exec, and on the treasurer to really help me understand that this year. So yes, I do feel very comfortable with what the county exec's budget
And
was.
when you look at those two lines, the daycare one is, I believe, rock solid. I mean, there's not much wiggle room there. And then the other Medicaid admin, those are relatively uneventful lines year to year.
Thanks.
How do we balance that? When we talk about having accounting firm come in and check for our reliability and our billing and look for increased revenues, do we feel comfortable, like we're spending $200,000? That's a lot
Sure.
of money to be spending. Do we have any thought process to,
They found us over $1 million last, a good chunk of change last time, and it's been.
to the 480?
Yeah, the return last time was massive.
And you know,
And it was
Chair.
the time before that, and it was.
And it's good to hear that that has continued.
And Chair, I just, we're eliminating some other contracts that we saw that we can do away with, because we feel like this is really important because of the success we've had in the past.
Sure.
And I would just share, it's rather difficult. The way we get memos, the LCMs, local commissioners memorandums, the ADMs, the administrative notices, the informational letters that we get, percentages on reimbursement can change, and eligibility changes on a weekly basis. And I'm not exaggerating that. So having someone come in and help us just really understand that is gonna be.
So my point was not that it was not worth
Sure.
$200,000 or what return. I was trying to get a handle on, what, being conservative with our budget as opposed to, it's a possibility that we might see $1 million. Again, it might be a possibility that we see zero, but we're confident that we're going to.
I would fairly say that to
Historically,
use one of the
say-
legislators' PEP's line, that we'd have a, zero, effect on that. Even if the 200, I have a feeling that we're gonna find at least 200 of something that we can do some cost savings on, if not more. Again,
I guess.
I'd be hesitant to invest it if we didn't think we were gonna get that return.
Well, we could increase our revenue more, is what I'm saying.
Yeah,
That was my point.
But I also think you said before, which was very important, that when they were here the last time, they taught us an awful lot of what to do. So if they're coming in and we don't find anything, we're still gonna get an education on some of the things to update and to improve, so that we continue going in the right way, or get better at what we're doing, so.
And a document that will help train people as they're coming into those positions.
Yeah.
the best for last, Chairman. I mean, we're wrapping up with a bow tonight.
Is that what you call it?
Something like that. So I guess I'll just start by giving you just a brief overview of where we're at this year. Just some very raw numbers. I know, we'll start with public health, obviously. Looking at our children with special health care needs, our early intervention and our 3 to 5. Year to date, we have served 55 children in our 3 to 5 program, which, as you know, is our most costly program. That cost projected for next year, as you'll see in my budget, was about $5.1 million. They're children with disabilities. We have to, by statute, pay for transportation, tuition, center services, and itinerant services. Our early intervention program, which is our 0 to 3-year-olds, we currently have 110 active children that we are paying for services. We did give providers a small increase. My guess is we will probably at some point have to give them another increase. We are well below what other counties are paying at $55 per session. Surrounding counties are paying anywhere between $70 to $80 a session. But again, our transportation costs for our our 3 to 5 special education services are where a majority of my public health budget goes. When we're looking at other programs where we are really excelling, just so you know, we've vaccinated over 600 animals this year to date in the county, and we still have several vaccine clinics happening for animals. 250 new people were trained in Narcan year to date. This year, we have participated in events like the Fonda Fair, where we trained 104 individuals at the fair on how to use Narcan, and I'm happy to say we had only 2 overdoses this year at the fair, which is a decrease in what we typically see. When we're looking at some of our other larger programs and our lead prevention program, we were able to train 130 individuals this year on lead renovator and safely removing lead from homes. So that's a big accomplishment. And we also were able to vaccinate in just this month alone 24 school-aged children to get them back up to speed and meeting the requirements so that they could start school. Questions about public health?
Are all of your,
That's right.
Chairman Pertel.
are all of your programs basically mandated programs?
They are. I don't have any programs that are not mandated unless they're covered by a grant. So our car seat grant, for example, is not a New York State mandated program. It's a service that we provide to the county, and it is funded through a grant. So anything that I do not have that is mandatory as per New York State, one of our 10 core programs or state aid reimbursable through Article 6, we do have a specific grant that covers that.
So out of the mandated programs, are they reimbursable programs? Are they 100% reimbursable programs? Are they
I'm glad you asked. I'm so glad you asked, because if you look in your packet that was created for you, you should have a spreadsheet that looks like this, and you'll notice that the very first line in pink, the public health department, just public health programs, only costs Montgomery County $59,985 to operate.
Could you repeat that?
Oh, you didn't get a copy. They didn't get a copy of this. Okay, so I will make sure that you get a copy of this. I thought it was in your packet. So $59,985 is all it costs in county dollars to support public health programs. Those are our mandated core deliverables. What costs so much, again, is our early intervention in 3 to 5 services. So that is a $5.187 million cost to the county. But out of that, we do end up getting 59.6% reimbursed up to a certain percentage from New York State. We also work with Medicaid reimbursements, what Jessica was talking about earlier. The lovely Department of Health at New York State sets that Medicaid rate and the reimbursables. So I have no control. Jessica has no control over that, but that rate is set by New York State.
So we get 60% back.
59.6. If you tell Connie it's 60, she'll lose her mind.
Can we back up on that right there? So you're
Absolutely.
saying is, there's a percent that we're gonna get reimbursed, but up to a certain, what's a certain amount?
It's the AVL, it's a cap. So
What is
it depends every year. It depends. So our AVL, our cap is different every year. On transportation, sometimes they will only reimburse up to 33 trips for that certain child. It's different for every single time we turn around. There is a cap. That's why we do an AVL every month.
And it's similar on social services.
It is
We
similar.
talk about the
Yeah.
percentage of reimbursement, but there's a cap.
Right, and like with our state aid, our base grant is $577,500. Anything we spend over that, our cap is 36%. We can't get reimbursed anything over 36% on that 5775. So to answer your question, I don't know because the AVLs change and the caps change from the state and transportation.
I have a question. Can I?
You have the floor.
Thank you. So when you're submitting for reimbursements, is it a similar platform as what's happening in social services?
Medicaid is Medicaid. You bill on 5, 10, 15, 30, 45, 60, and 90 days. If it doesn't get billed within that time period, it doesn't get paid out. You have those time frames.
So then in the cross-training that's happening and stuff, and in combining these departments all into one health and human service, are people from public health going over and social services and kind of having a?
Not yet.
Not yet.
But they will.
Yes.
We will. So we are going to start doing that. For example, why I asked the commissioner to sit with me is we are looking currently at nursing positions. So he is currently down nursing staff, and I have nurses, which helps him immensely. So we, in our new Health and Human Services combined initiative, will have a nurse that we share between the two departments who will be able to do some elder care work in our department, some education, injury prevention, working with our senior centers, but they will also be able to do the PRI assessments for nursing home placements through social services, which that is a reimbursable service. So we will be sharing that nursing position between the two of us. It will also help with that nurse who takes on that position to be able to have some supervision and oversight. I think the folks in social services do a great job, but they're not medical professionals. So when they're reviewing cases, are they appropriately looking at medical information, Medicaid billing numbers appropriate to the service or the diagnosis that the patient is getting?
So you'll see the position within DSS, however, we are doing this cross-training and cross-supervision in a lot of ways.
And how does it affect your reimbursement rate?
It won't because it'll be billed through DSS, but we will take on the supervision component to make sure that the charts and the peer review and the cases are not going to be rejected for payment. So as you know, Chairman Pertel, my department, we do Medicaid audits monthly, and that's where we catch any kind of billing mistake or Medicaid reimbursement that had been missed or misappropriated for the billing code. And we have a great auditor. We have a wonderful person on our PMQI who's been doing it for years, and we've only ever had one mistake.
So what we've determined is Sarah and I have talked about it, we'll do a percentage of cases that come from DSS, they'll be presented on a monthly basis, it'll be, whatever percentage of our total amount of cases, they'll get the feedback, we'll do the quality assessments there. Day-to-day supervision will be done at DSS, that type of supervision will be done through public health, as well as making sure that the mandatory trainings for the RNs are done. So, Sarah did a great job of explaining that, trainings change on an annual basis. It could have been when COVID was occurring, there was a new training, there was a new requirement. We may not get that information as timely as she does, so it just makes sense that those things are being done by public health.
So DSS will cover the day-to-day supervision, and we will handle the medical management.
Legislators.
So is the audit a mandated function?
It is. It's part of our PMQI, which is mandated by New York State Department of Health in order to have a Board of Health.
Which we have not utilized from a DSS perspective, so this will be the first time that we are really gonna utilize this process.
So it should help you do that.
Yes.
Perfect. Thank you.
Any other questions on public health?
Just, what was your budget?
A lot. Which component, Chairman Pertel? Right, but when you say budget, are you talking about children's services, overall, general public health? So we are looking at,
$173,000 net year-over-year increase, which is nothing.
Thank you.
Budget, last year appropriations 4.7, this year 5.2. Last year revenues 3.4, this year 3.7. So, it's on that synopsis sheet there.
Would you like to go over mental health now?
I
Okay.
think we could use some.
Yes, we'll end on a happy note. So mental health, this is going to be bad. So when we look at our mental health budget, our revenues, they are what they are. We can't change those. I can't go to the state and ask for more money for certain projects. What is the huge change that you're going to see this year, and actually next month, just FYI, you're going to see a huge resolution put up for me. I have currently 4 inmates who are receiving restorative services through New York State Office of Mental Health Psychiatric, who have been deemed incompetent for trial. I'm working with the DA's office. I've already had 3 of the inmates that we were supposed to pay for released, and we've come up with a different plan. However, the 4 that I have currently and the one that we have coming down the line, we just cannot work to get them other services. That's a cost of $41,308 a month, roughly. If there's a month that's 31 days or 30, it does shift about $1,400 a day because they charge you per day. That is a mandated fund that has to be paid by the county. We've been working with NISAC to try and shift that legislation so that the state picks up half of that fund. My thought is your jails are open, your state facilities are open. Why are we paying for them at the county level when you have them open and operating anyway? The county executive has been working with myself and NISAC to change that legislation, as have some other county executives. But for inmates at $41,000 a month is a large chunk of money. So this projection here, what's that?
41,000 per inmate or total?
Per inmate per month,
So
it's one-
4,000 for 4.
correct, per month. So when we look at my budget here, the executive budget has me down to 125. That'll be gone February. But I'm going to be coming to you next month and asking for almost $200,000, just so you know, out of the general fund to pay for the bills that we have outstanding currently for these inmates.
We don't have it.
What's that?
We don't have it.
You don't have it? The well is dry?
Well's dry. Send it out to the state, tell them we're dry.
I would love some assistance advocating from a legislative level with the state. Because it is, and the county attorney and I, several years ago, worked on getting a reversal on an inmate, and the state actually owed us money because they were wrong. They didn't understand that Megan and I were right, so they did owe us some money back. But these 4, the DA and I just we can't find a loophole on this one.
Talk to the judge, tell him to release.
What else?
When does your funding actually hit your budget, your revenue streams?
For which?
Mental health.
For mental health, we get that quarterly, so it's January, April, July, October.
They get advances, everything's advanced for mental health. And then usually I book an entry, usually biannual. That's what you're seeing. You're not seeing any revenue yet.
Dashboard,
It's in the deferred.
it's always in that one line.
It's in the deferred, it's
Yeah.
deferred right now. But yes, it is received quarterly.
With mental health, we get the money upfront and then we disperse it. Public health, we have to spend county dollars and then we get reimbursed. And just so you know, when the commissioner was talking about those Medicaid reimbursements, in our department, the state is behind 2 3/4, depending on the program. So our emergency preparedness, we are still waiting on Q1 reimbursements. So I know that the state is behind in sending out money. They're not very happy when you're asking them to give you the money that they owe you for work you've already done. And we're behind on Medicaid as well, almost.
What's their purported holdup? What would they tell you on the end, as an end user, where the money is? What excuse are they giving?
We're working on it.
Oh, great.